we? Why can't we have the same compensation, safety, and security that the other nurses at Kaiser, El Camino, Good Sam's, they are all receiving?
My name is Maybelline and I'm one of the nurses at Santa Clara County, and I'm here on behalf of my colleagues. I'm here to request that the county do better in protecting your nursing workforce. You have the obligation to provide quality patient care, which includes the safety of your nursing staff. Many nurses have spoken out about the alarming increased violence against us. Our negotiation team has been advocating for better safety language for months, and the county should be proactive rather than reactive. Last December, there were 2 nurses and 1 medical student who were stabbed in New Jersey hospital just because they told the patient's family that there were too many of them. And then 10 days ago, there was an incident at St. Louis where there was extensive property damage and many nurses were traumatized. Then 4 days later, there was an incident at O'Connor. Does there have to be a loss of life or limb for the county to wake up? The time is now to do something to protect your nurses. Protecting your nurses protects our community.
Hi, I'm Ryan from VMC RMPA. Good morning, supervisors. I stand before you today with a matter of utmost urgency: the escalating violence against nurses in their workplaces. This issue is not just a concern, but a crisis that demands immediate prioritization and action. Nurses, the lifeblood of our healthcare system, are increasingly subjugated to physical and psychological harm in their line of duty. This is not just an affront to their dignity and safety, but it is also critically undermines the quality and healthcare they provide to their community. We cannot afford to let this issue be overshadowed by any other. It is our duty as representatives of the county to ensure our healthcare professionals can work in an environment free from fear and violence. We must act swiftly and decisively. Prioritize the implementation of comprehensive safety measures such as enhanced security protocols, violence prevention training, and zero-tolerance policy. Let us not delay any further the safety and well-being of our nurses and consequently the health of our community. Thank you.
Dear Board of Supervisors, on January 13th, a patient at St. Louis Hospital became dissatisfied and began to destroy property. He was able to open the door of a locked unit and throw computer monitors around. The on-site security followed the patient around, unable to stop him because they can only observe and report. 911 was called, but because of the ongoing debate about jurisdiction, there was a delay. We desperately need workplace violence language in our RMPA contract and effective security in place. Because as one nurse observed, it is no comfort to know that my death or detriment will be duly noted. Thank you.
Thank you. If I could call forward the next 5, please. James Mount, Laura Nuno, Jin Nuno, Annie On, and Alice Mansell.
Hi, good morning. My name is Alyssa Dulong. I'm a nurse at VMC and the treasurer of RMPA. As RMPA nurses, we have come before you to ask for your help to keep nurses safe. Today, I'm asking once again, we need something now and something that really makes a difference. Recently, there was an incident of a patient who was having a psychotic episode who tried to leave the hospital. It was unclear at the time if he was trying to jump from the 4th floor stairwell. Nurses stopped him and brought him back in. Nurses also brought him back to the room while security was called, but they argued with our nurse on the phone that they can't do anything if the nurse isn't on a 5150 hold. What we need is security that can respond quickly and able to provide hands-on assistance. We also need to expand our behavior response team so that they're available all hours and not just on day shift. We need more training to know the proper way to handle situations like this if help isn't coming. Thank you.
Hello, my name is James Mount. I work for RNPA and I'm a nurse in the ICU at St. Louis. I'm here today to discuss as with the other topics recently in regards to workplace violence. On the 13th of this month, St. Louis experienced a traumatic event to the staff due to a patient who destroyed a room in the ICU, broke through the ICU doorways, and proceeded to threaten staff and family members in the ICU. He actually pushed and shoved a security officer, but again, because they have a hands-off approach with private security there, they weren't able to stop him. County references one line in the contract that they will abide by the OSHA standards, and our members and employees need more than that. They need specific statements to address workplace violence and safety concerns. Thank you.
Hello, my name is Laura Nuno. I am a L&D RN from St. Louis Hospital. I've been working there for over 24 years. I've seen many changes over those years, and the new ownership with county has actually decreased the care of our labor and delivery patients and serving our communities. They do have the clinics there, but the people in the clinics, the nurses or the patients are told to deliver at San Jose. So these are patients that are compromised, they don't have the resources, and it is a burden for them to go up 20 miles to San Jose to deliver their babies. We've been supporting these families and a community hospital, and we're supposed to be a community hospital, and I say we need to support our community and let them deliver in their community hospital. The other thing is, we don't have any washcloths in the hospital. So, interesting.
My name is Jen Nuno, and I'm a nurse at St. Louis Hospital in maternal child health. I'm here to address the county's push to float the nurses on my unit to other facilities, as well as placing med-surg patients on the maternity unit. The nurses on this unit give antepartum, labor and delivery, nursery, and postpartum care, circulate and recover C-sections, and take care of post-op GYN patients. We have no support staff, unit clerk, OB tech, HSAs, or A&M, and we take on those roles as well. There are no doctors in-house. We're a low-risk unit. However, as a critical access point to the hospital, we take care of any high-risk patient that walks through the door. In the emergency, the nurses initiate the emergency care while we wait for the doctor to come. There's no other set of nurses in this hospital system that do all the roles that we do. Asking us to take on even more roles by floating or putting med-surg patients on our unit stretches us too thin. Ultimately, patient safety will be compromised, and there's an increased risk of bad outcomes. Please put safe patient care back at the top of the priority list and stop pursuing floating us to other facilities.
Hi, my name is Annie. I'm a VMC emergency department nurse. There's a significant increase in workplace violence in our health and hospital system. It will continue to rise if there are no repercussions, and we need an aggressive prevention plan and approach to keep this from happening. The county said that there is a long, extensive plan that they have in place that has no tolerance for violence. Yes, that looks good on paper, however, is not a good resolution to what us nurses face on a daily. Safety measures need to be put in place to keep us all safe. The other day, a patient was in a severe car accident. He broke his leg in half. He had his neck collar on to protect his neck. He wakes up yelling and screaming, demanding to get him out of there. Not knowing if he had an injury to his neck, he continued to pull his collar off. I stood there holding his neck in place while he's swimming at me and calling me names, explaining to him that if he has an injury, he can be paralyzed from neck down. I am avoiding his swings as I wait him to help protect him from further injuries. My point is that the nurses are devoted to keep patients safe and care.
Hi, I'm John Corkery, a member of RNPA and a nurse at St. Louis Regional Hospital. We as nurses, caregivers, and providers are on the front line of the county's safety net. We are working around the clock, day and night, through every holiday to provide passionate care to all of our grandparents, parents, brothers, sisters, children, and friends who are suffering grave illness, psychosis, drug addiction, alcohol withdrawal, depression, suicide, and abuse. We have a difficult job and are risking our lives and well-being to help and heal Santa Clara's residents on their darkest of days. We work relentlessly for all of you in this room. Why can't we be provided the safety, security, and compensation that providers in the private sector are receiving? That's a question for you guys. Why can't we? Why can't we have the same compensation, safety, and security that the other nurses at Kaiser, El Camino, Good Sam's, they are all receiving?
Hi, my name is Gina. I woke up at 3 o'clock today morning so I could finish up my work so I can get 2 hours to come here and talk to you and be a voice for the nurses. These nurses right here took care of my daughter, and I cannot believe that they are worried about their own safety. My daughter is walking today. She is going to school. She just started school yesterday, and it is because of these hardworking nurses. You have no idea what they do. I was in the hospital for 8 weeks as a caregiver for my daughter, and I've been trained for 20 years to see how people work and what work ethics they have, and these nurses are amazing. And I cannot believe that they have to come here and ask for their safety. When we are at a vulnerable position and we cannot take care of ourselves, we cannot pee, we cannot poop, and we throw up, they take care of us. And I cannot believe they have to come here and fight for their safety.
We're now moving to speakers on Zoom. So I would ask if anyone on Zoom who intends to speak doesn't have their virtual hand raised to please do it now. We will close the queue with the visible number when the first speaker begins speaking.
I currently am holding at 2.
Okay, let's give that another couple of seconds. No one adds? 2 it is. Thank you.
All right, Alan, I've asked you to unmute. Please accept the unmute.
Hi, good morning. Board of Supervisor, can you hear me?
Yes.
I thought I was gonna get 2 minutes, but I guess I just want to echo. My name is Alan Kamara. I'm a registered nurse working at Santa Clara County in East Massachusetts. I want to echo the sentiment of that family who stood there with emotions to tell you what we do on a daily basis. And for us to come here every time and remind you how unsafe we feel when we go to work is sad. I know you think we have security. Private security are not the answer. And I'm sorry, St. Louis today doesn't have security. O'Connor today doesn't have one. And when you talk about jurisdictional conflict, whenever there's an incident, that's a time that slows down for a response. It's not a matter of if, it's a matter of when something's going to happen to one of our nurses. These videos are going to be played at all the meetings.
Yeah, thank you so much, number one. And the second thing is regarding the issues on security. I understand that some of our security guards might not carry weapons, but the fact that if all they do is report and observe and not able to restrain physically, I don't feel that this is providing the necessary security in our hospitals or ED or anywhere, basically, for that matter. So I would like to ask maybe either Alpha Gen report, something you could get back to us on making sure that we have those capabilities to protect our workers.
As the board is aware, excuse me, the board approved new classifications for sheriff's PSOs. Those are being implemented in stages as training occurs and will be implemented across all of our hospitals. And those individuals have a different level of training, a different ability to respond, and will be ultimately replacing the private security at O'Connor and St. Louis. So that plan has been approved by the board. It's in place. I'm not sure exactly where the sheriff's office is in terms of the training of the current PSOs into SPSOs, but that is the safety plan to move to our employees with a higher level of training and a higher statutory ability to use certain equipment pursuant to the penal code.
Yeah, if there's something, maybe you could work with the sheriff's office to come up and give us an off-agenda report of where that's at. I certainly appreciate it because certainly safety is a high need. And until the training is done, is there any way we could get someone in there now so that they could be protected? Because clearly it doesn't sound like it was based on the incident in earlier January when these individuals broke out of the room and damaged lots of property and all that.
Yeah, it's really dependent on the actual bodies that the sheriff's office has. They have the codes. The board has authorized the positions, so it's a matter of folks completing the training so that the sheriff can deploy them. But we'll ask the sheriff's office to provide an off-agenda on the status of that.
Okay, and there's some issues regarding St. Louis that's been mentioned, whether it's labor delivery or something like no wash off. I don't know how serious those issues are, but if you could ask Paul maybe to take a look at that.
I already did.
Okay, thank you.
What do we want? Progress! When do we want it? Now! What do we want? Safety! When do we want it? Now! What do we want? Education! When do we want it? Now!
If you enjoyed this video, please like, subscribe, follow, double tap, and comment below to let us know how we're doing. All of it really helps to get the video out there. Thanks again for watching, and we'll see you in the next one.